have received certain questions from our viewers. I'm going to present these questions to Dr. Ashok and take his views from traditional medicine point of view. The first question we received is, somebody had coronavirus and now they have lack of appetite and lack of taste in their mouth and certain smells in their mouth. What can they do about it?
Basically, these are the common symptoms patients face after most of the viral infections, and the simple way to treat these symptoms is they has to do the control fasting. Control fasting we called Langana in Ayurveda, and that helps to boost up your digestive fire. And even though after trying the control fasting for a week, if the symptom doesn't improve, best to add is cumin and carom seeds. You can boil them in a 1 liter of water and then sip that water throughout the day.
A viewer has complained that he suffers with bronchial asthma and sarcoidosis. What precautions should they be taking?
Basically, to these patients, I strictly recommended them just 100% quarantine, 100% isolation. They shouldn't take any chance because they are a very high risk categories of the patients. If they catch coronavirus, unfortunately, it's going to be very difficult for them to come out of it. And I strongly recommend it to these patients. They have to put as much protective plan for their health, as much as protective cover to their health. And the best important thing for them is to start with as earliest as possible lot of foods and lot of supplement which is rich in high dose of antioxidant, specifically vitamin C. I suggest them they should start using amla powder on day-to-day basis. They can use trifla, they can use holy basil, giloy, tulsi, ashwagandha, silajit. They should add these traditional herbs into their day-to-day life without any delay.
The next question presented is, somebody had coronavirus and now they are suffering with abdominal pain and diarrhea. They would like to know how long could these symptoms carry on and what can they do about it?
So basically, coronavirus is also equally damaging for our digestive system. It just completely disturbed our natural digestive system. It just disturbed our natural bacteria flora. And to improve the natural flora, to treat this symptom, basically we have to improve our natural bacteria flora. And best way to improve the natural bacteria flora is just make buttermilk at home. In that buttermilk, you should put some fresh coriander leaves and roasted carom seed, roasted cumin seeds. You can blend them all together and drink it at least twice a day. Along with that, it will be also very helpful if they are able to make some lentils and rice khichdi at home and just mix a banana into it and eat it in a small proportion 2 to 3 times a day. These symptoms generally start recovering after 2 weeks of the active infections but can take up to 4 to 6 weeks time.
Out of concern for a family member, a viewer has asked, if somebody is on steroids or suffering with diabetes, what can people with such high risk do to prevent coronavirus?
First of all, we have to understand that this patient who is already having a diabetes and taking steroid along with that means they must be suffering from some autoimmune disease. And that's why to suppress their immune system and immune response, they're taking the steroids. But that basically combinations of diabetes and steroids put the patient into very tricky situations, and they comes under very high risk categories of the cases. The best solution for them is best way out from them is that they have to generally slowly withdraw their steroids and change the steroids with the natural herbal compounds. There is a lot of potent natural herbal compound like boswellia extract. They can use silajit, they can use giloy, they can use basically ashwagandha. They can use a lot of natural compound which can reduce the inflammations, and they make sure that their diabetes stay under control. And make sure, because these cases are very complicated cases and suffering from a chronic medical conditions, so best for them they should take the advice of their Ayurvedic medicine physician before taking any kind of herbal compound.
Dr. Ashok, the viewers will like to know what is the best preventive plan in the traditional medicine to prevent yourself from coronavirus.
Best protective plan is first thing people has to take the fear out of their mind, because fear creates anxiety leads to stress, and stress further weaken our immune system. So they has to really understand it that the stress and the fear is not going to help them. Secondly, they should with dedication should start practicing pranayama, because the coronavirus attack our respiratory system. along with our digestive system. So if they're doing pranayama improve the flow of air in our respiratory system and strengthen our lungs. Third things, because in our day-to-day life we don't eat a lot of herbs and spices and a lot of substances which we need to boost our immune system. So I strongly suggest to people they should start using some natural traditionals, herbal compound which are existing and which is recommended in traditional science from thousands of years. Very simple of them, like aloe vera, giloy, tulsi, neem, ashwagandha, silajit. They should put all these kind of a herbal compound. They can be taken all together in a small proportion, or they can be taken individually based on the patient's requirement. So they should start taking them. Third thing, they should start practicing yoga and meditation in day-to-day life and make sure they are drinking enough fluid, and specifically the warm fluid, during the day. If they are drinking tea, they make sure they put in some ginger and carom seed into it. They are drinking hot water, make sure they put kind of a tulsi leaves and cumin in that and boil it and drink it.
Viewers, I hope you have received the answers that you were seeking. If you have any more questions, please email Dr. Ashok, or you can type the question up on the Facebook of Dr. Ashok Ayurveda, and we hope to get back to you as soon as we can.